Most people think dementia always starts the same way, forgetting names, losing your keys, repeating the same question twice. But that is only one story. There are others. And some of them are much harder to catch because they don't look like memory loss at all. They look like a personality change, a mood swing, a stumble, a strange dream that turns out to be something else entirely. I'm Dr. Michael, and today we're going to walk through something that touches almost every family eventually, whether we like to admit it or not. Not just what dementia is, but which kind. Because here's the part almost nobody tells you. Dementia is not one disease. It's a name for a group of conditions, and each one comes from a different kind of damage happening inside the brain. Some are common, some are rare, some overlap so closely that even trained doctors with scans and years of experience can struggle to tell them apart. Stay with me, because by the end of this, you're going to understand something that could change how you watch the people you love, the small things you brushed off, the odd moment last Thanksgiving, the little slip that made you pause for half a second before deciding it was nothing. It might have been nothing, but it might not have been. Here's why this matters more now than it did for your parents' generation. People are living longer than at almost any point in history, and that means more families are walking into this fog without a map. Doctors will often mention the same word over and over, dementia. But what a quick 15-minute appointment rarely has time to explain is that underneath that one word sit completely different diseases, doing completely different damage in completely different parts of the brain. Treating them all the same, in your own mind, is like treating a broken arm and a broken heart with the same bandage. So let's actually open this up, piece by piece, type by type. Because once you understand the differences, you may never look at a senior moment the same way again. Let's start with the one almost everyone has heard of, Alzheimer's disease. This is the most common form. It accounts for somewhere between 60 and 80% of all dementia cases. So when most people picture dementia, they are really picturing Alzheimer's without knowing it. Here is what's actually happening inside the brain. Abnormal proteins begin to build up. Two of them, called amyloid and tau. They accumulate slowly, quietly, for years before anyone notices a single symptom. By the time memory problems show up on the outside, changes have often already been happening on the inside for a long time. That's the first unsettling truth. The outside can look completely normal while something is already shifting underneath. Alzheimer's usually starts the way people expect. Short-term memory goes first. Someone asks the same question 3 times in an hour. They forget a conversation from yesterday, but can describe their wedding day from 40 years ago in perfect detail. That contrast, sharp old memories and foggy new ones, is one of the earliest fingerprints. But memory loss is just the beginning of the list. And this is where it gets personal, because these are the signs doctors and researchers actually watch for. Trouble planning or solving problems that used to be simple. Following a recipe suddenly feels like defusing a bomb. Paying bills becomes confusing in a way it never used to be. Difficulty finishing familiar tasks, driving a route they've driven for 20 years, using the microwave, getting dressed in the right order, losing track of time or place, not knowing what season it is, forgetting how they got somewhere, trouble with images and space, misjudging distance, struggling to read, having difficulty with balance in a way that isn't physical, new problems with words, stopping mid-sentence, calling a watch a hand clock, struggling to follow a conversation, misplacing things and losing the ability to retrace steps, not just losing the remote, putting it in the freezer and having no idea how it got there. Poor judgment, falling for a scam that would have been obvious a year earlier, giving away large amounts of money without a clear reason, withdrawing from social life, skipping the hobbies they loved, avoiding conversations because keeping up feels exhausting now, mood and personality changes, confusion, suspicion, anxiety that wasn't there before. 10 signs, all connected to one underlying pattern. And here's something important. 1 or 2 of these on their own don't mean anything scary. We all misplace things. We all blank on a word sometimes. What matters is a pattern, a shift, a before and after. Think about someone who used to run the household finances without a second thought. Checkbook balanced down to the penny, and now suddenly can't remember whether the electric bill got paid. Think about someone who cooked the same holiday meal for 30 years, and this year forgot a step so basic it made the whole family go quiet at the table. Those are the moments families remember afterward, not the diagnosis. The moment before the diagnosis, when something felt wrong and nobody said it out loud. And here's a detail that surprises a lot of people. Alzheimer's doesn't erase memory evenly. It usually attacks the newest memories first, the conversation from this morning, the name of a new neighbor, while leaving decades-old memories strangely intact. That's why someone can forget what they had for breakfast, but describe, in perfect detail, a childhood summer from 70 years ago. It isn't that the brain is failing everywhere at once. It's failing in a very specific order, and that order is part of what a doctor is trained to recognize. Now, if Alzheimer's were the only story, this video would already be over, but it isn't. And the next type is one that catches people off guard, because it isn't really about the brain slowly aging, it's about the blood that feeds it. This one is called vascular dementia. It's the second most common type, making up roughly 5 to 10% of cases. Here's the mechanism. The blood vessels that carry oxygen to the brain get damaged or blocked, sometimes from a single stroke, sometimes from years of smaller, silent injuries that add up quietly, one after another, until the damage becomes visible in behavior. This is where high blood pressure, diabetes, and high cholesterol enter the picture. They aren't just heart problems. They are brain problems waiting to happen, because the same blood vessels that feed your heart also feed the part of you that remembers your grandchildren's names. Vascular dementia doesn't always creep in slowly like Alzheimer's. Sometimes it happens in steps, a stroke, a plateau, then another decline. Families often describe it as sudden drops rather than a gentle slide. The signs to watch for here are slightly different. Confusion that comes and goes, trouble concentrating, like the mind keeps sliding off a task, thinking that feels noticeably slower, like wading through water that wasn't there before. Here's the part that should genuinely make you sit up, because this type is tied to blood vessels, and blood vessels respond to how we live. This is one of the few types where daily habits, blood pressure control, movement, diet, may meaningfully affect the risk. That doesn't mean any method guarantees prevention. Nothing does. But it does mean this isn't purely bad luck. There's a thread of control here that some other types don't offer. Picture two people, same age, same family history. One has spent decades with blood pressure quietly running high, never quite high enough to feel dangerous, never quite treated aggressively enough to matter. The other has kept it managed, checked, controlled, same genes, same starting point. Very different exposure to the kind of slow vascular wear that can eventually surface as dementia. That's not a guarantee either way, but it's a reminder that this particular type has a door that stays at least partly open to the choices made years before any symptom ever showed up. Families often notice vascular dementia in a strange way. Someone will seem completely fine for months, then suddenly sharply seem different, a little slower, a little more confused. Then they'll level off again. That step-like pattern, decline, plateau, decline again, is one of the clues that separates this type from the slower, steadier slide of Alzheimer's. Now, let's go somewhere stranger, somewhere most people have never even heard of until it's already in their own living room. Lewy body dementia. This is the third most common type, and it might be the most misunderstood of all of them because it doesn't just affect thinking, it affects perception itself. The cause is a buildup of a protein called alpha-synuclein, forming abnormal deposits inside brain cells. And what it produces is genuinely unlike anything we've covered so far. Hallucinations. Not vague confusion, but detailed, vivid visions. Seeing a child sitting quietly in the corner of the room. Seeing animals that aren't there. And here's the unsettling twist. The person often knows, at least at first, that what they're seeing isn't real. They're not confused about reality. They're watching something intrude into it. Delusions can follow. Suspicion of a spouse. Belief that someone has replaced a family member with an imposter. Then, movement problems appear. Tremors, stiffness, a shuffling walk. The kind of symptoms that look exactly like Parkinson's disease, because the two conditions share the same underlying protein pattern. And then there's sleep, acting out dreams physically. Shouting, kicking, thrashing during REM sleep, sometimes years before any other symptom shows up. Doctors now consider this one of the earliest possible warning signs of Lewy body dementia, appearing long before memory problems ever do. This is exactly why Lewy body dementia gets misdiagnosed so often. It doesn't knock on the front door of memory. It sneaks in through movement, through sleep, through hallucinations that make families think psychiatric issue long before they think dementia. Imagine a husband waking his wife in the middle of the night, worried because she was shouting and kicking in her sleep like she was fighting something off. Or a daughter noticing her father staring at the corner of the kitchen, calmly describing a dog that isn't there, then a moment later, laughing it off, saying he knows it isn't real. Those moments don't scream dementia to most families. They look like nightmares. They look like eccentricity. They look like something to mention at the next appointment, if it comes up at all. And that delay, that gap between the first strange symptom and the actual diagnosis, is exactly where Lewy body dementia hides longest. There's another layer here worth knowing. People with Lewy body dementia can be unusually sensitive to certain medications, particularly some used for psychiatric symptoms, in ways that can make things noticeably worse rather than better. This is one more reason an accurate diagnosis, rather than a guess, genuinely changes the path of care. Now here's a type that flips the usual pattern completely, and it tends to strike people at an age nobody expects. Frontotemporal dementia. Unlike the others, this one often shows up in people younger than 60. Think about that for a second. A condition normally associated with aging, arriving in someone still working, still raising a family, still years away from retirement. It's linked to abnormal buildup of proteins called tau and TDP43, but the damage concentrates in the frontal and temporal lobes, the regions that govern personality, judgment, and social behavior. And that's exactly what changes first, not memory, personality. Apathy appears, a sudden loss of motivation or interest in things that used to matter deeply. Mood shifts happen without warning. Social tact disappears, saying things bluntly or inappropriately in situations where the old version of this person would have known better. Families often describe this one as the cruelest because it doesn't feel like losing someone's memories. It feels like losing who they were as a person, while their memory of yesterday's breakfast stays completely intact. This is precisely why frontotemporal dementia gets mistaken for depression or a midlife crisis, or even a marriage falling apart, long before anyone considers it might be neurological. Picture a wife watching her husband, once the most careful, most diplomatic man in every room, suddenly saying things bluntly at family dinners that make everyone flinch. Or a man who used to plan every vacation down to the hour, suddenly showing no interest in planning anything at all, not out of laziness, but because something in the part of his brain that generates motivation has quietly gone dim. Coworkers might notice it first, actually, long before family does, because frontotemporal changes often show up as sloppy judgment at work before anyone at home connects the dots. A missed deadline, an inappropriate comment in a meeting, a once sharp colleague suddenly making decisions that don't add up. Because this type usually strikes earlier in life, it often gets missed by doctors too, simply because dementia isn't the first thing anyone considers in someone in their 50s. That delay can stretch for years, years spent chasing a psychiatric diagnosis or a relationship explanation, before a neurologist ever enters the picture. Now here's where things get genuinely complicated, and where even modern medicine has to admit its limits. Mixed dementia. This is when someone has two or more of these types happening at once, most often Alzheimer's, combined with vascular damage. And here's a number that surprises almost everyone. Autopsy research has found that 54% of people diagnosed with Alzheimer's while they were alive actually had additional brain changes beyond typical Alzheimer's pathology when examined afterward. Read that again. More than half. The most common additional finding was undetected vascular damage. The second most common was Lewy bodies. What that tells us is something doctors are only recently starting to fully grapple with. Mixed dementia may not be the rare exception. It may actually be closer to the norm, just hiding beneath a single label, because that's how it gets diagnosed while someone is still alive. And here's something else worth knowing, because it explains why diagnosis can feel so frustrating for families searching for a clear answer. A 2024 study using detailed brain imaging to distinguish frontotemporal dementia from other conditions only reached 71 to 89% accuracy. Not certainty, not perfection, a range. Even with advanced imaging tools, telling these types apart precisely remains, in some cases, more art than exact science. This is not a flaw in your doctor. This is the honest current edge of what neurology can and cannot yet do with total precision. Think about what that actually means for a family sitting across from a specialist, waiting for a clean answer. Sometimes that clean answer simply doesn't exist yet, not because the doctor hasn't looked hard enough, but because the biology itself overlaps in ways science is still working to untangle. A brain can carry the plaques of Alzheimer's, quiet damage from decades-old blood vessel changes, and a scattering of Lewy bodies, all at once, all contributing a little, none of them alone, explaining the whole picture. That's not a rare, unlucky exception. Based on that autopsy data, it might be closer to how dementia usually looks once you get past the label on the chart. This is also why two people can be told they have the same kind of dementia and progress in completely different ways. The label captures the dominant pattern. It doesn't always capture everything happening underneath. Before we get to the myths, there's one more thread worth pulling because it ties every type we just covered back together. None of these four diseases exist in a vacuum. They share some of the same soil. Physical activity, for instance, doesn't just help the heart. It appears to support blood flow to the brain, which matters most directly for vascular dementia, but likely plays some supporting role across other types too, since a healthier vascular system tends to support a healthier brain overall. Staying socially and mentally engaged, conversations, puzzles, learning something new, doesn't erase risk, but researchers increasingly think it may help build something like a reserve, a cushion, that lets the brain compensate a little longer before symptoms become visible. Sleep matters too, and not in some vague wellness sense. Remember that detail about acting out dreams as an early sign of Lewy body dementia. Sleep disruption isn't just a symptom to watch for. Chronic poor sleep over many years is itself being studied as something that may contribute to risk, not just reveal it. None of this is a guarantee. Nobody watching this video and nobody making it can promise that any daily habit fully prevents any of these diseases. Genetics, age, and simple chance all play a role no lifestyle choice can fully override. But no guarantee is not the same thing as no influence. There's a real difference between a coin flip you have zero control over and a set of odds you can quietly shift in your favor year after year, decision after decision. So, let's clear up a few things that get twisted along the way, because misunderstanding these details can cause real harm, either unnecessary fear or false reassurance. Dementia and Alzheimer's are not the same word for the same thing. Alzheimer's is one type, the most common one, but only one branch of a much bigger tree. Dementia is also not a normal part of aging. It mostly affects older adults, yes, but mostly older is not the same as inevitable. Getting older does not automatically mean losing your mind. Plenty of people reach their 90s with sharp thinking intact. Memory loss doesn't automatically mean Alzheimer's either. Some causes of memory trouble are completely reversible. Things like vitamin deficiencies, thyroid issues, medication side effects, even depression, mimicking symptoms that look identical to dementia on the surface. This is exactly why a real medical evaluation matters so much. Some of what looks terrifying is actually treatable, and memory isn't even the defining feature for every type. As you just saw, frontotemporal dementia and Lewy body dementia often start somewhere else entirely: personality, movement, perception, while memory stays untouched for a surprisingly long time. There's one more myth worth clearing up, because it quietly shapes how people react. Some assume dementia only touches people well past retirement, age 70, 80, older. But when it develops before 65, it has its own name. Young onset dementia, and frontotemporal dementia in particular, tends to show up before 60. That means a working parent, still raising teenagers, still years from retirement, can be facing this. It's rare compared to the numbers in later life, but it's real enough that you're too young for that is not a safe assumption to lean on. Put all four myths together, and a pattern emerges. Almost every wrong assumption about dementia pushes people in the same direction, toward waiting longer than they should before getting an actual evaluation. Believing it's just aging delays a visit. Believing it's always Alzheimer's can mean missing a treatable, reversible cause. Believing it's always memory first can mean overlooking frontotemporal or Lewy body symptoms for years. The myths don't just confuse people, they cost time. And with dementia, time is often the one thing that matters most. So where does that leave you, watching this video, maybe thinking of your mother, your husband, your own occasional forgetful moment? Here's the honest, grounded truth. No video, no checklist, no symptom list can diagnose anyone. Not this one, not any other. What a list like this can do is something different and arguably more useful. It can tell you when something is worth a real conversation with a real doctor. Not because one missed word or one lost set of keys means catastrophe, but because patterns matter, and doctors are trained to look for exactly the kind of pattern we just walked through. Some causes of these symptoms are treatable, some are manageable for years with the right care plan. And in the types tied to blood flow, some of the risk may genuinely be influenced by things like blood pressure control and staying active, even if nothing guarantees full prevention. Early conversations create early options. Late conversations often mean fewer of them. Think about what early actually buys a family. If a memory problem turns out to be a vitamin deficiency or a thyroid issue, catching it early can mean it's fully reversible, gone, as if it never happened. If it turns out to be vascular in nature, catching it early can mean managing blood pressure aggressively enough to slow future decline, rather than watching it accelerate unchecked. If it turns out to be Alzheimer's, early diagnosis opens the door to treatments, planning, legal and financial decisions made, while someone can still fully participate in making them, and time, real time, spent together while communication is still easy. None of that is available in the same way once things have progressed further down the road. That's the actual practical difference between noticing something at month 1 instead of month 18. And here's something for the person watching this who isn't thinking about a parent or spouse, but about themselves. Maybe you've had a moment, forgetting why you walked into a room, blanking on a familiar name for a few uncomfortable seconds. Take a breath. Occasional forgetfulness like that, especially under stress or when you're tired or juggling too much at once, is common at every age, not just after 50 or 60. The line researchers actually look for isn't a single slip. It's a noticeable change from how your own mind used to work, one that other people around you have started to notice too, and one that's actually interfering with daily life, not just mildly annoying you once in a while. If that describes what you're seeing in yourself or in someone you love, the next step isn't panic, and it isn't a search engine at 2 a.m. It's a conversation with a primary care doctor who can run basic tests to rule out reversible causes first, before anything more serious is even on the table. That single appointment, the one that feels intimidating to schedule, is usually the fastest way to either get real reassurance or get pointed toward real help. So here's what I'd leave you with. Not a warning to be afraid of, but a question to actually sit with. Think back to the last time you saw someone you love and something felt slightly off. Maybe you brushed it aside. Maybe you told yourself it was just a long day, or getting older, or nothing at all. Was it really nothing, or was it the very first sentence of a story you haven't started reading yet? Here's one more thing worth carrying with you after this video ends. Somewhere out there, right now, a family is sitting at a kitchen table, noticing something has changed and quietly deciding it's easier not to talk about it. Maybe out of fear, maybe out of hope that it will just pass on its own. Maybe because naming it out loud makes it feel more real than staying quiet does. But silence doesn't slow any of these 4 diseases down. It just slows down the moment help arrives. The families who look back afterward with the fewest regrets are almost never the ones who caught everything perfectly on day 1. They're the ones who said something out loud a little earlier than felt comfortable. A doctor's appointment that turned out to be about nothing costs an afternoon. A doctor's appointment that turns out to matter can reshape everything that comes after it, for the better. That's really what understanding these 4 types is for. Not to hand you a diagnosis from your couch, not to make you fear every forgotten word or misplaced set of keys, but to give you just enough of a map that if something ever does feel off, in yourself, in a parent, in a spouse, you'll know it's worth a real conversation with a real doctor sooner rather than later. This is general health information based on medical and research sources, not a diagnosis. If something you saw here resonates with your own life, the next right step isn't more searching. It's a conversation with a doctor who can actually look closer.